So tonight we're talking about shin splints, which are a pretty common overuse injury that most runners experience. The most common form of shin splints actually takes place on the medial or posterior side of the shin. And it's thought to be either micro tears in the muscles or inflammation in the connective tissue between the bone and the muscle. Either way, it can be very painful and it can derail your training. So one of the first things that you want to do when you start to experience shin splints is follow the RICE principle. So R stands for rest. No runner likes to take time off, but unfortunately, if you are training on top of an injury and just trying to push through it, all you're going to do is backslide, make it worse. So the most important thing to do is listen to your body. Start cross training for a little while to maintain your cardio fitness. So now's a great time to learn or work on incorporating biking or swimming, maybe even the elliptical or just walking. Either way, whatever you do, you want to avoid an incline at the moment because we don't want to to exacerbate that issue. So when your shin splints are flaring up, one thing, the next part of the acronym is ICE. So we want to work on reducing the inflammation, and there's a couple ways that you can do that. So one way is with a Dixie cup. So you can take a Dixie cup and fill it up with water and freeze it, and then you can tear or cut the top off of the Dixie cup. I guess I should rehearse this part. To expose ice, and then you can apply it to that sore area. Good idea to have a towel present in this situation. You can work on this for about like 20 minutes at a time, working on loosening out that or cooling down that area and reducing the inflammation. That's a really messy option. So another thing that you can do is use a frozen water bottle. So this is excellent. By the way, you take a water bottle, you want to dump a little bit of it out, so because ice expands. And we're going to put the shin or the Achilles area over that frozen water bottle, and you can kind of use it sort of like a foam roller, just rolling forward and back over that area. If something feels a little bit tight or tender, just like hang out there, let the coolness come, let it relax. It should feel really good, and like relieving. Your next part of the RICE principle is going to be compression. So there's a lot of ways that you can do that. You can either wrap your shin with an ace bandage, so just like around the shin area, so that helps to protect it and get a little bit of compression in there. But you want to keep it loose, right? Well, not too loose, enough that you have some room for swelling. You can also use compression socks. And another thing you can do is use some KT tape, rock tape, whatever you have. So what we're going to do is we're going to take the tape, and we want to place it about 2 fingers from the beginning of your first and second toe. And you're going to measure to the fibular tuberosity over on the outside of your knee. Okay, and then we're going to cut that length, make sure we got it right, and then we're going to peel both sides of the tape, just a couple inches, and then you don't want to stretch the tape when you're applying it to the area. So the origin points, you want to keep that nice and loose. Otherwise, your tape's going to come off. And we'll go ahead and apply part at the top. Bear with me here because taking this tape off of the sticky can be a little challenging. And we're going to stretch that tape a little bit. Again, making sure that we're not stretching the tape in the place where we're applying it, right there at that fibular tuberosity. We'll pull off the backing the rest of the way. And then you're going to point your toes and you're going to just press the tape down along your shin bone and that end. It should feel nice and kind of supportive, maybe even a little bit tingly. And then you can cut lengths of tape to go around the shin in your more sensitive areas. I recommend at least 2 points of support. So we'll do that from just one, about 4 inches underneath the knee. And we'll do another one just a couple inches above the ankle too. Again, be careful not to stretch the tape in the areas along the edges. Through the middle is okay to stretch, but you don't want to stretch it around the edges. Come on, little tape. So, just like that. So that'll give your shin a lot of support and hopefully help alleviate some of the pain, so that you can at least get out and go for some walks while your shin splints are bothering you. You can wear the tape for about a week.